launched this improvement science snapshot on using realist methods for design and evaluation. My name's Rebecca and I work with the improvement science theme of the Yorkshire and Humber Applied Research Collaboration. In my work, I often use an approach called realist evaluation. This approach was originally developed for evaluating social programs, but it's increasingly popular for evaluating healthcare interventions. The benefit of this approach is that it helps us to understand why an intervention provides benefit in some settings and not others. From a realist perspective, interventions in and of themselves don't lead to outcomes. It's how people choose to make use of, or not, the resources that the intervention provides, and those choices are highly dependent on context. Realist evaluation deals with this by building, testing, and refining stakeholders' theories of how the intervention works. We construct these theories that describe the particular context that will trigger a mechanism to lead to particular outcomes. And when we talk about mechanisms, we're describing the combination of intervention resources and people's responses to those resources. The first step in realist evaluation is eliciting stakeholders' theories of how the intervention works. We might do this through interviews. So for example, we can interview the intervention designers to get their ideas on how the intervention works. And then we can extend our list of theories by interviewing those responsible for its introduction. We can also gather stakeholders' theories from the literature. Good sources of theories include editorials, commentaries, and policy documents. In a study we undertook on robotic surgery, we looked at the discussion sections of studies of robotic surgery, which, written by surgeons, were a rich source of theories about why robotic surgery did or didn't work in their hospital. We then expanded this list of theories and revised those theories through interviews with theatre teams. The next step is to test those stakeholder theories. Realist evaluation doesn't require particular methods of data collection, but it is an explicitly mixed methods approach. To understand context, we might choose to use ethnography. So for example, in the robotic surgery study, we observed and video recorded operations across different hospitals. And it was through doing this that we were able to understand the different attitudes to the role of the scrub practitioner in different hospitals, and that the impact this had not just for teamwork, but for patient safety. Because mechanisms are about people's reasoning, we'll often use interviews to gather data about those mechanisms. And finally, for outcomes, you typically want quantitative data. So for example, in the robotic surgery study, quantitative data that we collected included measures of teamwork and participants' ratings of the mental workload they experienced. There's increasing interest in using realist evaluation for design. In a study we undertook, we used realist methods to design and evaluate a quality dashboard. This dashboard was intended to support managers and clinical teams in making better use of national clinical audit data for quality improvement. We started off this project by undertaking a realist evaluation of the use of national clinical audit data. This helped us to understand the contextual factors that supported and constrained the use of national clinical audit data for quality improvement. That helped us to inform what functionality the dashboard would need to provide in order to overcome those constraints. So to recap, the key points that we have covered are that realist evaluation answers not just what works, but what works for whom, in what circumstances and how. It involves eliciting and testing stakeholders' ideas about how an intervention works. It involves multiple methods of data collection, gathering both qualitative and quantitative data, and it can also be used to inform the design of an intervention. Thank you for watching this Improvement Science Snapshot.